Your doctor says your blood pressure should be 120/80. But here's the real question. Should it? If you're over 65, that number might actually be too low for your body, and forcing it there could be doing more harm than good. You might feel dizzy when you stand up, tired for no reason, or even scared to leave the house because of another fall. And yet you're told, keep taking the pills, just a little lower, just a little longer. But what if the real answer isn't in chasing a perfect number, but in listening to your body? In this video, we're uncovering what major studies found about blood pressure in older adults, the hidden risks of over-medication, and simple, natural steps you can take at home to stay safe without overdoing the drugs. Stay with me. This might be the video that helps you take back control. So where did this number, 120/80, even come from? Who decided that was the golden standard for everyone at every age? It sounds simple, neat, reassuring, like there's one perfect zone we should all aim for. But your body isn't a textbook. It's a living, breathing story. And as we age, that story changes. What worked for you at 45 might not work at 75. And the truth is, chasing 120 in your later years could be like trying to run a marathon with shoes 2 sizes too small. Sure, you might get there, but you'll be limping the whole way. That's why today, we're diving deep into the science, the stories, and the real risks behind perfect blood pressure in seniors. You'll discover how one major study completely changed the rules, and how millions of older adults, maybe including you, were suddenly labeled hypertensive, not because they were sick, but because the rules moved. And more importantly, we'll show you how to take back control with common sense, smarter conversations with your doctor, and lifestyle changes you can actually stick to. Let's start with where the confusion began. The medical guidelines that redefined what normal blood pressure should be, and why that may not fit your reality at all. If your body were a vintage clock, your blood pressure would be the second hand, constantly moving, endlessly ticking, always needing attention. But here's the truth. Trying to pin your blood pressure at exactly 120/80 might be like trying to freeze time. It sounds ideal, but is it natural? Especially after 65, blood pressure tends to shift. Arteries stiffen, hormones change. The heart has to work just a little harder to push blood through aging vessels. It's not a flaw, it's part of the aging process. But instead of adapting to that reality, many doctors still cling to one number, 120/80. For years, it's been seen as the perfect reading. TV ads repeat it, pamphlets print it, and patients are told to chase it, no matter their age, their health, or how they feel. But here's the catch. In 2017, the American Heart Association and the American College of Cardiology changed the guidelines. They lowered the threshold for high blood pressure from 140/90 down to 130/80 for everyone. Overnight, tens of millions of people, many of them seniors, were suddenly classified as hypertensive, even if they had no symptoms, even if they felt perfectly fine. That's like changing the rules in the middle of the game. Imagine getting an A on your test, only to have the teacher say, "Sorry, we raised the passing score. You failed." That's what happened with blood pressure. And the fallout? More prescriptions, more side effects, and often more fear. Because when you hear the words high blood pressure, it's hard not to panic. But before you do, let's look at the research behind these guidelines. Let's see what they're based on and whether they truly apply to you. For decades, we were told that 120/80 was the gold standard, the perfect blood pressure, the number to chase, no matter your age. Like some magical safe zone, that number became gospel. Doctors repeated it, commercials sold it, and patients, especially seniors, were pushed to get there, sometimes at any cost. But here's what they didn't tell you. In 2017, the American College of Cardiology and the American Heart Association did something huge. They changed the rules. Quietly but dramatically. They lowered the threshold for high blood pressure from 140/90 down to 130/80 for everyone, regardless of age. Just like that, overnight, tens of millions of people, many of them older adults, were suddenly labeled hypertensive. No new symptoms, no changes in how they felt, just new numbers on paper. It's like moving the finish line after the race has already started. One day you're fine, the next day you're a patient. But let's pause for a second and really think about this. Should a 35-year-old marathon runner have the same blood pressure goal as a 75-year-old grandmother with arthritis, kidney issues, and a fall risk? Of course not. The body changes with age. Arteries stiffen, hormones shift, kidneys don't filter the same. So why are we giving them the same finish line? And here's where things get tricky. Because under the old guidelines, if your blood pressure was 135/85 and you were 70 years old, your doctor might say, "You're doing great, keep it up." But under the new rules, that same number now earns you a diagnosis, and likely a prescription. It's no wonder so many older adults are being pushed to take stronger medications. More pills, more side effects, more confusion. And all for a number that may not even suit their age or medical history. So, where did this drastic change come from? Why did the medical community suddenly lower the bar? The answer lies in a massive research study, one that shook the foundation of blood pressure treatment around the world. It's called the SPRINT trial. And what it found was both eye-opening and controversial. But before we jump into it, let me ask you something. If a study told you that lowering your blood pressure could save your heart, but might harm your kidneys, would you still want to lower it? Because that's exactly the dilemma doctors are facing. And in the next section, we're going to break down this study and what it really means for you. Keep watching. This might be the most important part. Let's go back to 2015. A groundbreaking study was published that caught the attention of doctors worldwide. It was called the SPRINT trial, short for Systolic Blood Pressure Intervention Trial. The goal? To find out whether aggressively lowering blood pressure, specifically the top number, the systolic, could prevent heart attacks, strokes, and even death. They took over 9,000 people, all aged 50 and older. These weren't average patients either. These were high-risk adults. People with kidney disease, heart issues, or multiple risk factors for cardiovascular disease. But they specifically excluded anyone with diabetes, dementia, or a history of stroke. And then they did something bold. They split them into two groups. One group followed the standard treatment plan. Keep systolic blood pressure below 140. The other group followed an intensive plan. Push systolic blood pressure under 120, using stronger medications. Think of it like tuning a car. The standard group drove safely under the speed limit. The intensive group pushed the engine harder, more fuel, more pressure, more performance. And after 3 years, the results seemed impressive. The intensive group, those with blood pressure kept below 120, had fewer heart attacks, strokes, and deaths compared to the standard group. In fact, their rate of serious cardiovascular events dropped from 2.19% per year to 1.65%. That's nearly a 25% reduction. To many doctors, it looked like a miracle. But there's a second half to the story, one that didn't make the headlines quite as loudly. Because while the intensive group had fewer heart problems, they also had more complications, more episodes of dangerously low blood pressure, more fainting, more acute kidney injuries, more electrolyte imbalances that could lead to muscle cramps, fatigue, or even hospital visits. So yes, They won the race against heart disease, but they also took more hits along the way. Here's a simple way to think about it. Imagine you're watering a delicate garden. Turn the hose up just enough and everything thrives. Turn it up too high and you flood the roots. Turn it too low and nothing grows. That's what this study revealed. While lower blood pressure can be beneficial, pushing it too far, too fast, especially in older adults, can cause more harm than good. Now here's where it gets personal. If you're over 65 and your doctor is aiming for a systolic below 120, it may be because of this very study. But did that study include people like you? People with memory challenges, people already prone to falls, people taking 5 or 6 other medications? No, it didn't. And yet, its conclusions have shaped the way millions of older adults are treated. So we have to ask, is what's ideal on paper always ideal in real life? It's a question only you and your doctor can answer. But one thing's for sure, there's more to this story. Because 3 years after Sprint, another major study came along, this time from the other side of the globe, and it changed the conversation once again. Let's look at that next. Just a few years after the Sprint study shook the medical world, another major trial came along, this time from China. It was called the STEP study, and its goal was similar: to see if lowering blood pressure more aggressively in older adults could lead to better outcomes. But here's what made STEP unique. This study focused entirely on people aged 60 to 80, over 20,000 participants, all seniors, all facing the same questions you might be asking right now. They divided the group into 2 treatment plans. One aimed for a systolic blood pressure of less than 150 millimeters of mercury, the standard, more relaxed target. The other aimed for less than 130, a more aggressive goal, similar to the Sprint strategy. So what happened? Once again, the lower target group had fewer major cardiovascular events, especially strokes, which, as we know, are one of the most devastating outcomes of untreated high blood pressure. They even showed lower rates of all-cause mortality, meaning fewer people died overall in the intensive treatment group. Sounds great, right? But, and there's always a but, just like in Sprint, the aggressive group also faced more side effects, more cases of dizziness, electrolyte problems, and kidney issues. And remember, this was a carefully monitored clinical trial. In the real world, where seniors manage multiple prescriptions and health concerns, those risks can be even higher. So once again, we're back to the same tightrope. Lowering blood pressure helps your heart, but push too far, and it may hurt your kidneys, your balance, or your overall well-being. This is why lifestyle changes for high blood pressure matter so much, especially for seniors. Instead of relying solely on medication, many doctors now encourage natural strategies first. Things like daily walks, cutting back on sodium, eating potassium-rich foods, practicing deep breathing exercises, staying hydrated, managing stress and sleep. These are all powerful, research-backed ways on how to lower blood pressure naturally at home, without over-medicating or tipping the scale too far. Because numbers don't tell the full story, and not every senior's body responds the same way. In the next part, we'll dig into something even more important: how your body changes with age, and why slightly higher blood pressure might be part of your body's natural survival plan. Stick with me. This next insight could explain what your doctor hasn't. Let's take a step back and look at something rarely talked about. What if your rising blood pressure isn't a mistake, but a natural adjustment your body makes to help you keep going? You see, just like a garden hose that stiffens after years in the sun, your blood vessels become less flexible with age. They lose their give, which means your heart has to push a little harder to get blood through them. That slight increase in blood pressure isn't always a warning sign. It can be part of how your body adapts to stay alive and functional. But here's the catch. When doctors or guidelines try to force those numbers back to a youthful ideal, like 120/80, it can sometimes cause more harm than good, especially in older adults. Let's imagine your body as a vintage car. You don't drive it the same way you'd drive a brand new sports car. You don't slam the brakes, redline the engine, or expect 0 to 60 in 5 seconds. You ease into turns, you listen to the engine, you respect the wear and wisdom. That's how we should treat blood pressure in seniors. Of course, you don't want it soaring out of control. Symptoms like headaches, blurry vision, chest pain, or sudden fatigue can all be signs of dangerously high blood pressure symptoms and should never be ignored. But a reading of 135 or even 145 systolic might be perfectly acceptable for someone over 70, especially if they feel well, are active, and show no warning signs. That's where lifestyle changes for high blood pressure come in. Instead of chasing lower numbers with stronger pills, many seniors see better results when they take a gentle, sustainable approach. Eating whole, unprocessed foods, walking daily, even just 15 minutes, practicing calming routines like stretching or deep breathing, staying hydrated and limiting caffeine, getting quality sleep and emotional support. These are not quick fixes, but they are lasting ones. They represent how to lower blood pressure naturally at home, in a way your body understands and respects. Because sometimes the problem isn't your pressure, it's the pressure to be perfect. And in Part 6, we're going to look at what happens when that pressure leads to overtreatment and how too much medication can do more harm than good. Let me tell you a story. Bill is 78. He walks with a cane, has mild arthritis, and takes 5 medications each morning. He's never had a heart attack, never had a stroke. But last month, his doctor noticed his blood pressure had crept up to 138/84. So the doctor adjusted his medication. Let's get that top number under 120, they said. 3 days later, Bill stood up from his recliner, got dizzy, stumbled, and hit the edge of his coffee table. A bruise, a sore rib, and a shaken sense of confidence, and all because we tried to perfect a number. This happens more than you might think. In older adults, aggressively lowering blood pressure with strong medications can lead to a chain reaction: dizziness, fainting, falls, hospital visits, even kidney damage or confusion from electrolyte imbalances. In short, the treatment becomes more dangerous than the disease. It's like watering a flower with a fire hose. The intention is good, but the pressure is too much, and the damage is done before you even realize it. You see, blood pressure symptoms aren't always dramatic. Sometimes it's just feeling more tired than usual, or getting lightheaded when standing, or feeling unsteady walking across the kitchen. And these symptoms can often be caused not by high blood pressure, but by too much medication. That's why doctors are now rethinking their approach. Not every senior needs to be pushed to 120. For some, a systolic reading of 140, even 145, may be safer, more sustainable, and more in tune with how their body actually functions. So what should you do? Start by talking to your doctor. Ask, are my blood pressure goals realistic for my age? Can we review my medications? Are these symptoms from the pills or the pressure? And while you're at it, consider shifting focus from prescriptions to prevention, because the best way to avoid overtreatment is to reduce the need for treatment in the first place. That's where lifestyle changes for high blood pressure shine. Simple routines like reducing sugar and refined carbs, eating more leafy greens and potassium-rich foods, walking daily, breathing deeply before bed are small steps with long-term power. They represent a better way on how to lower blood pressure naturally at home without risking falls, fatigue, or fear. In the next part, we'll answer the big question: when is high blood pressure truly dangerous? And what numbers should never be ignored, no matter your age? Keep watching. We've talked a lot about how blood pressure can be overtreated. But let's be clear, there is a point when high blood pressure becomes truly dangerous. A point where hesitation is no longer an option. Think of it like the red zone on a pressure gauge. A few ticks above normal may be manageable, but cross the red line and something's going to burst. So, what is that red line? Most doctors agree, if your systolic pressure, that's the top number, rises above 170, and your diastolic, the bottom number, goes over 100, you've entered what many consider crisis territory. At those levels, the risk of serious events, like stroke, heart attack, or kidney failure, increases dramatically. And here's the problem. Blood pressure symptoms aren't always obvious. You might feel perfectly fine, or you might have subtle signs: a pounding headache, sudden dizziness, chest tightness, numbness in your face or limbs, blurry vision, trouble speaking. These aren't just aging. These are red flags. If your readings are that high, especially if they're consistent or come with symptoms, it's time to act. This isn't about chasing perfection. It's about preventing catastrophe. But here's where wisdom matters. Acting doesn't always mean throwing more medications at the problem. It means working closely with your doctor to find the right balance between managing the risk and protecting your quality of life. And yes, medications may be necessary at this point, but that doesn't mean lifestyle is off the table. Even in a crisis, your habits matter. This is why lifestyle changes for high blood pressure remain essential, even when numbers are high. And if you've ever wondered how to lower blood pressure naturally at home, know that it's not just about prevention, it's part of the solution. In the final section, we'll bring everything together and explain why you, not a number, should always be the center of your treatment plan. Let's finish strong. Let's bring it all home. Over the last few minutes, we've looked at numbers: 120, 130, 140, 170. We've talked about studies, pills, side effects, strokes, and statistics. But here's the truth nobody says out loud. You are not a number. You are a whole person, a life story, a collection of experiences, aches, habits, joys, and memories. And yet, too often, healthcare reduces us to a chart, a cuff reading, or a target. Let's get you under 130. Try this new medication. Don't worry, everyone your age takes something. But where's the room for how you feel? For your energy, your balance, your sleep, your fears? Where's the space to ask, is this even right for me? Because when it comes to blood pressure, there's no one-size-fits-all. Some people thrive at 125. Others do better at 145. Some feel dizzy at 120. Others feel fine at 150. That's why the smartest health decisions come from partnership, not pressure. Yes, high blood pressure can be dangerous. Yes, it's a silent risk for stroke, heart failure, and kidney disease. But so is overtreatment, especially in older adults. You deserve a plan that reflects you, not a population average. That means understanding your personal blood pressure symptoms, tracking how you feel day to day, reviewing your medications regularly, making sustainable lifestyle changes for high blood pressure, and learning how to lower blood pressure naturally at home, without rushing, without panic. Because sometimes healing doesn't come from doing more. It comes from doing what's right. That might mean asking your doctor, "Do I really need this pill?" It might mean trying morning walks before adding another drug. It might mean sleeping better, drinking more water, or finally cutting back on processed foods. These aren't radical steps. They're small, powerful acts of care, and they work. You've made it this far in the video, so let's take one more step. Subscribe to this channel, not because we have all the answers, but because we ask the right questions, because we speak directly to seniors like you, because we believe your health journey deserves clarity, compassion, and a little bit of courage. You are not your blood pressure reading. You are more, and we're here to walk this journey with you, one heartbeat at a time.